Well, I'm an ultra runner, and my skin, as I've aged, has gotten extremely thin. My fat level's very light because I'm an ultra runner, so I spend about 70 miles a week running. And I was getting wrinkles all around my face.
Pam is actually my nurse anesthetist who's been working with me for a number of years and has had an opportunity to see work which I've done on other patients. She had some redundancy of skin in her jowl and lower neck and cheek area, and she's very thin but has lost elasticity in her face.
I talked to him, and then I waited about a year and tried to think if this was something I wanted to do or if it was something that I could live without doing. And because I run 100-mile marathons, I honestly don't feel 56. So when I would look in the mirror, I could see a lot of my face just almost falling off. The skin was just so thin.
We're actually providing fat and transferring it from one area of her body to another, not just as a filler, but as a method to rejuvenate her face. And we're doing this with a transfer of fat with stem cells. And so this is a kind of a new technique which we're using now for individuals like Pam.
Totally happy and satisfied. I am very grateful. If you pull out a picture of me back when I was in college, it just looks like I'm an older sister, and I love that. You know, I don't want to look like I'm in my 20s and 30s, but looking like I'm in my 40s, that's okay.
Patients come in, they basically want to look as good as they feel. They sometimes will ask, am I too young to have this done, or am I too old to have this done? And basically it doesn't matter. Basically, if they are physiologically fit and psychologically appropriate, then they're good candidates for surgery. But it has nothing to do with your chronologic age, clearly.
It's been wonderful, but the best thing about that is I feel good about myself. You know, I take a lot of time in maintaining my health, and I feel young. And now I just feel like I look young.